Welcome, it's Brian Terrian, and it is Medicare season, and we've been talking to lots of people about their disability benefits, their health care coverage, and I've collected some stories that I want to share with you about individuals that are on just Medicare A and B, or just Medicare A, and why they're on it. Is it a fit for them? This is my opinion, what their vulnerabilities are, and if it's not. So I'm in hopes that these 7 different case studies, if you will shed some light on what your options are if you're on just Medicare A and B, or if you know somebody that's on Medicare A and B, or if you're considering going back to just Medicare A and B. So here we go. And I didn't reveal the full names of these individuals to keep them anonymous. So the first one I'll refer to as G and L in Texas, husband and wife. Same situation, they're on Medicare A and B. They have chosen not to get a Medicare Advantage plan or a Medigap plan, as with all of these others. And their reason is that they drive over 2 hours to get treatment at a hospital, and because they like the treatment. And so what that means is they don't have any primary care or any treatment locally where they live. And if they were to get a Medicare Advantage plan, they wouldn't be able to go to their doctor or treatment center that they are currently enjoying because it's over 100 miles away. Medicare plans, most of them work within a 100-mile radius. You can see your treating physicians there. And of course, you travel if you have an emergency or something. Most of these plans cover you as well. The challenge with that is if something catastrophic happens, which it unfortunately does, heart attack, car accident, some major medical event, they are responsible for 20% of the entire bill. So that's the treatment that they're having. They are enjoying it and it's working for them, but it could be just enormously expensive. Here's the next one, Jasmine. Jasmine is Medicare eligible and Medicaid eligible. She's dual eligible, and she is convinced that if she was to get a Medicare Part C, an Advantage plan, to replace her Medicare A and B, that she would lose her Medicaid, even though the plans that have been submitted to her read specifically that they're dual eligible and only eligible for people that are on Medicare and Medicaid. Still is not convinced. The downside of this is there really isn't the large out-of-pocket risk for somebody that's on Medicaid, because you can go to a treatment facility that accepts Medicaid and they'll cover you. The downside is this individual is living on a very tight budget, and just moving to a Part C plan would provide her with $1,200 a year in shopping credits. I think there's a $50 a month gift card, dental, hearing, vision that's better than what she could possibly get now. So it would change her financial situation. Plus, if you're on just Medicaid, you have very limited doctor network. If you go into a Medicare Advantage plan, you have a vast array of doctors that you can see. Or if you just stay on A and B, that's one of the advantages, is you can go anywhere, right? You're a free agent. So that is one advantage. Example number 3. This is Mike in Texas. He's getting his meds, which are super expensive, like a Tier 4 or Tier 5, from a clinic. And so he's paying Zippo. If he moved and got a drug plan, an independent drug plan, or if he moved into a Medicare Advantage plan, then the clinic would not be able to provide the drugs. The Medicare Advantage plan or drug plan would be responsible for that, and they don't cover the drugs. So in his situation, the workaround is to get what's called a pre-authorization from the insurance company, whichever Medicare Advantage plan it is, to pre-authorize that drug to be covered, so that he can get on a plan and still not have to take that big hit for drugs. So that one, there's a workaround in progress. D and L, here's another couple. They don't want to pay for Medicare Part B, but they're eligible to get it for free. So this is kind of crazy. They opted out of so they could save this year the 144.60, but both of these individuals are at the income level and the asset level where they would qualify for a program called Extra Help, which would eliminate the 144.60. So they've been walking around with really only coverage to go to the hospital, not being able to see doctors, and not getting treated because of the additional expense, which leaves them vulnerable in two ways. One is if they get a disability benefit review and you're not being treated for the conditions that are disabling, then that's going to cause problems with you being able to keep your benefits, because that is the rule. Right in your award letter it says you need to maintain your condition treatment so that you can prove that you're eligible. Two is catastrophic event. Once again, if something was to happen to either one of these ladies, they have no coverage whatsoever. Okay, so let's see. Oh, here's another one. This one is Mary. This is this is a unique one, and she's just on Medicare A and B. She says, I don't care if I have a major medical event. I'm just going to go to the hospital. I'm going to rack up a bill, and I'm going to stick it to the man. So she just isn't concerned about you know, the hospital bill or anything like that. So this is the last example, and this one actually is a fit, in my opinion, for this individual in her strategy. She worked for the government for years, retired from the government, and still has their health insurance. So that health insurance is a secondary, and her primary is Medicare. And she has lots of conditions that she is being treated for. So in her situation, the 20% that Medicare does not pay is picked up by her secondary insurance. So she has a $10,000 bill for, you know, a major medical event. That $2,000 paid for by the secondary. So that works well. In addition to that, she travels a lot. She's between several states, and this gives her the ability to have primary care doctors and other treatment options available in other states. If she was moved to a Medicare Advantage plan, she would be restricted within that 100-mile radius, and she wouldn't have the flexibility that she does. So this one, perfect. I think that's a fantastic fit. So I hope these examples have been helpful for you to help you understand. The biggest concern that we have here is so many people out there, believe it or not, are just leaving themselves exposed on a limited budget to a major medical event and the bill that's associated with it. And that's what I'm in hope that this message helps you understand and possibly prevent, or somebody that you might know. So for more assistance on your benefits, getting your benefits reviewed, there's other ways to maximize your benefits that we know of here, and we review them for you for free. You just complete the form below this video or wherever this video is, and we'll look at the information that you submit, send you some information. We might need to get on the phone with you to help better understand the situation, but depending on, you know, where you're at in the country, what your disability check is, what your condition is. There's so many different options that are available that you could possibly pick up and maximize your benefits even further. So you know somebody that might benefit from this, please share the video. If you like the work that we're doing, of course, give us a thumbs up. I hope you find it valuable. Make it a great day. This has been Brian Terrian. Thanks.